You just couldn't find another fiver.
Yeah, basically.
The other thing is, really, is the bed. Is like being a single bed. It was a bit too small for a single bed.
Nearly there. So
You're nearly there.
Thank you very much.
We're certainly looking at it as a compliment, aren't we? He only dropped us by £5.
Next, it's Vicky's room, billed at £125.
100, 120, 130.
That's a £5 overpayment.
Perhaps that was,
Ralph's fiver.
No, I thought, in comparison with others that I stayed in, that yours was that much better.
Well, thank you very much.
Thank you very
I
much.
want to make that clear. For me, Robin and Risers easily outshone the others. Easily.
Finally, Clarky and Katie, with Clarky's room priced at £125.
80, 120, 40, 60, 80, 200 pounds.
That's a £75 overpayment.
You picked £75 overpayment.
What?
It was well deserved. Massive.
Oh, hi.
Do you know,
I am doing this.
The whole experience was quite magical.
my head is bursting crying. Thank you very much.
Liza and Robin have got something there that's very special. There's something to be proud of. And our overpayment was completely spot on. Yeah, I think it's well deserved.
Now all the payments are in, it's time to reveal the results.
So, in fourth place, we have the Terrace. So that's you, Vicky.
Wow, is that reserve champion?
No, that's last. It's 4th out of 4.
Oh, I feel totally shafted, mate.
In third place, the new Promenade. Ralph and Chrissy, well done.
At least I'm not the last,
I was
so
just about to
it's
say that.
still giving me, there is always hope,
The top slot is now between the White Hart Hotel and Tall John's house.
The winner is... Tall John's house!
Are we deserved winners?
Oh, yes.
Yeah. I mean, the competitors voted and we won. Hands down.
With the new Promenade Hotel holding back £5, the Terrace overpaying by £5, and the White Hart Hotel overpaying by £75, Tall John's house wins the competition with a final bill average of 120%.
It's an absolute pleasure for me to present you with this. Congratulations.
Thanks.
Delighted, I'm really delighted.
I think
Boris
we
is
won
in the deep.
because we really
That ball came across in absolute shreds.
Deaths. Well, it comes then as a hospital in Hertfordshire declares a critical incident and tells patients to stay away from its accident and emergency department. And meanwhile, as many as 4,000 prisoners are to be released early from jails in England and Wales because of the pandemic. More than a dozen residents are believed to have died from COVID-19 at a care home in Glasgow in the past week, but Burlington Court Care Home can't confirm it as no tests were available to be carried out. And as the weather heats up, then the Association of Police and Crime Commissioners has warned forces are facing a big challenge to get people to stay at home this weekend. We'll have much more on that later, but first back to the news that the Department of Health has confirmed that 4,313 people have now died after contracting coronavirus. The rising death toll comes as one of the government's most senior advisors on the coronavirus pandemic has warned the UK could see high rates of infection for weeks and weeks if the lockdown rules are flouted this weekend. Catherine de Costa reports.
Everybody better stick to it this weekend, I'll tell you. Because if the dinner is pitting, we're all going to be locked in for weeks. The dinner.
its needs as long as your patients are stable so that we can take a step back. So it is very daunting, it is very challenging, but so far my staff is doing a wonderful job.
With routine ops cancelled, resources can be diverted. This unit for treating heart attack patients has become a storage room to free up space. So that this ward for the elderly can become an ICU. We talk a lot about the front line in the fight against coronavirus, but this is about as close as you're actually going to get to it. Beyond that is the hot zone. It's the infected area of this. Ventilators. Previously, the hospital could treat 7 patients in intensive care. When this unit comes online, it'll be 46. So have they done enough?
We can get plenty of beds and ventilators. What we can't get is the staff that is skilled to look after those patients. So I think that's really the rate limiting factor.
Oh.
This disease.
Yes.
Usual.
Let's take you live to Downing Street now. Michael Gove, who's about to speak with today's press briefing.
Good afternoon, and thank you for joining us for our daily briefing in the fight against COVID-19. I'm joined today by Professor Steve Parris, Medical Director of NHS England. I'd like first to update you on the facts about the spread of the coronavirus. Then I will outline why it is so critical that we continue to observe the rules on social distancing. Thirdly, I'll explain what we're doing to increase the capacity of the NHS to deal with this disease. And finally, I want to say something about how we can all work together to defeat this invisible enemy. First, the facts as they stand today. As of 9 AM today, a total of 183,190 people have been tested, of which 41,903 tested positive. 15,073 people in England have been admitted to hospital with COVID-19 symptoms. But the pattern of hospital admissions in England and Wales has regional differences. In London, the number of admissions fell slightly between the 1st and 2nd of April. Admissions are steady in Wales, but in Yorkshire and the North East, they've gone up by 35%. And in the Midlands, the rate of hospital admissions has gone up by 47%. 708 people have sadly lost their lives as a result of COVID-19. The highest daily total of 183,190 people have been tested, of which 41,903 tested positive. 15,073 people in England have been admitted to hospital with COVID-19 symptoms. But the pattern of hospital admissions in England and Wales has regional differences. In London, the number of admissions fell slightly between the 1st and 2nd of April. Admissions are steady in Wales, but in Yorkshire and the North East, they've gone up by 35%. And in the Midlands, the rate of hospital admissions has gone up by 47%. 708 people have sadly lost their lives as a result of COVID-19, the highest daily total yet recorded. And that means that of those hospitalised in the UK, the number who passed away now totals 4,313. Those numbers emphasise again the importance of maintaining social distancing measures to halt the spread of the disease. More than ever, we must stick with it, as the Prime Minister said in his video message. Now, I know that life under lockdown can be challenging, and some will be tempted on this sunny weekend to venture out and about. But, as the Health Secretary underlined yesterday, if we relax our adherence to the rules, we increase the risk for others. That's why it's so important to stay at home, to protect the NHS, and to save lives. We need to think of those on the front line and the sacrifices that they're making for us. As the Chief Nursing Officer for England reminded us yesterday, Ruth May asked us to remember 2 NHS nurses who died after contracting COVID-19. Arena Nasreen, who was just 36, and Amy O'Rourke, aged 39, each had 3 young children. They died while doing everything they could to help the sick and the suffering. We can all best honour them by playing our part in fighting the disease, by staying at home and slowing the spread. 7 healthcare professionals have now lost their lives to COVID-19, and we offer our heartfelt condolences to their grieving families and to the many others mourning the loss of loved ones. They include the family of Ismail Mohammed Abdul Wahab, who died aged just 13 in King's College Hospital in London. His mother and siblings are showing symptoms of the virus, and they were unable to say their final goodbyes at his funeral. In their despair, the loving, dignified tributes from Ismail's parents are truly haunting. Our thoughts today are also with the family of the 5-year-old child with underlying health conditions, who's tragically died. So again, you must stay at home to protect the NHS and to save lives. Whatever the temptations this weekend, please don't go outside to visit the lakes, the beaches, the countryside. Take pride instead in keeping your own families and communities safe. The more we restrict contact, the more we slow the spread of the infection, the more time we have to build capacity in the NHS so that we can treat those who are most in need. I want now to outline how we're increasing NHS capacity. Yesterday we were grateful to His Royal Highness the Prince of Wales, himself recently recovered from coronavirus, for opening the brand new Nightingale Hospital in East London, a testament to brilliant teamwork and determined leadership from the NHS. 2 weeks of hard work have transformed a convention hall into a fully functioning field hospital that can treat 500 COVID-19 patients on ventilators or through oxygenation. New Nightingale hospitals are due to be built in Birmingham, Bristol, Cardiff, Belfast, Glasgow, Harrogate and Manchester. And given that we know that the Midlands are a particular area of concern, the NHS and the military are accelerating their existing work to transform the National Exhibition Centre in Birmingham into a 2,000-bed Nightingale hospital. I've spoken to the Mayor of the West Midlands, Andy Street, earlier today, and he is doing all he can with the NHS to accelerate that work. Of course, a critical part of ensuring the NHS is resilient is improving the testing of staff. 10,984 tests were administered yesterday, and as the Health Secretary outlined on Thursday, we have a strategy to increase that number to 100,000 a day. Testing is a critical part of the clinical pathway that we all follow in seeking to reduce the impact of COVID-19. But the next vital step is appropriate pharmaceutical treatment. That is why, as the Health Secretary explained, clinical trials are now taking place to see if antivirals, which have helped in the fight against HIV, and anti-malarial medicines such as hydroxychloroquine can reliably reduce the harm that the coronavirus inflicts. The next stage in the clinical pathway is ensuring that those patients with impaired lung functions get the oxygen they need. And this is where ventilation comes in. We've been working to increase ventilator capacity across the NHS. Ventilation can be non-invasive and invasive. Effective non-invasive ventilation can ensure patients do not need to be placed on invasive ventilators, where they're intubated and supported to breathe with machinery which takes oxygen direct into their lungs. We've secured new non-invasive capacity with the help of UK manufacturers who've worked at pace to develop new technologies. A team from University College London, working with Mercedes-Benz, have produced a new device which has been clinically approved. They produced 250 yesterday, will produce the same number today and tomorrow, rising to 1,000 a day next week. We're also increasing the capacity of the NHS to deploy invasive ventilation. We've been buying invasive ventilators from partners abroad, including Germany and Switzerland, and today 300 new ventilators arrived from China. I'd like to thank the Chinese government for their support in securing that capacity. And we've developed new sources of supply here in the UK, with existing and modified models being made in greater numbers, and new models designed to come on stream soon. The first models, which are being scaled up as part of the ventilator challenge, will be coming off production lines this weekend. More are to come into operation in the coming weeks.
Hello? Hi, Graham. Uh-huh. Uh-huh. put it through the door, but I've lost all track of when I did that. Aye, that'll do for next month. Aye, don't worry about that. I'll let you off. I never even realised because I thought I put that through your door a month ago, so that shows you how. Aye. I'll ask him. I'll ask him. So what is it? No, well, that mini that he had, it was my brother. He had it for years. So I mean, his kind of like quite minted. So, aye, it's all come. Aye, well, I'll say to him. Oh, right. Right. I did ken whether I'll say to him, but I did ken because he's not got a lot of space. He used to have the double garage, so it's nothing big, right? All right, in a wee box, right. Aye, I'll say to him, Graham. So it's like just stuff for doing up all cars. So right, I'll say to him. No, well, I had sickness and diarrhea last night. I was no well at all. It just hit me all of a sudden, and I was on the phone to my mum and I says I hate to go, and I did. A couple of days before it, I felt like kind of like that and all, and then it just took the legs from it. Oh my God, I was feeling no well the whole night. Obviously, it's no coronavirus because that's no one of the symptoms, but so I've been taking it easy all day today. I've been taking it easy all day today, but we'll probably go out for a walk maybe the night later on or something. Alan, he's fell asleep. He's sitting here sleeping. We were watching four in a bed and then he's fell asleep. So what about you? How are you getting on? Aye, I know. Aye, that's right, the tip's shut. Aye. That's right. I know. I'm just watching. I just watch the update every day for the Prime Minister. You can the coronavirus daily update. I do watch. Listen to all the newspapers and all this because I just watch it for Downing Street, the live one for Downing Street. I'm watching that the new for the horse's mouth. Aye, but I mean Shelley, she's on the front line doing it at the Victoria Hospital and she's like the charge nurse in her ward and she's in tears every night. She says it's just horrific. And they've been told to expect in the next few weeks 80 deaths a day at the Vic. Aye, she says it's just, and I thank God. And that's how it's that important that folk didn't go down the beaches and everything this weekend. Aye, I know. And you're going to get a load of idiots going out thinking, oh, it'll be alright. But is Hazel got to go out? thought she was like a tortoise. She was hibernating. Aye, what's he called again? Aye, you've been framed. Has she got out on the bike? Listen, please tell us when you are going, right, so we can see it. Oh dear. Oh, well, this will be. I normally hate to go along with my mum's because she's stuck in the house, eh? So I just go along and get her messages, and then I stand in her garden, like I didn't go in her house. But this is the first day I've not been able to do it because I do want, like with me feeling like this, I do want to pass anything on with this, eh? So, but Alan, he's got to set up a disco in the conservatory, so he's going to do a live radio show, so that'll keep it. Aye, he's going to do a live radio show, so once he's doing it, I'll let you in when he's doing it. Of course, we've already been, I'm saying, you know, it's not, then I think, Christ, we've got to be stuck in here for weeks, so it's, you just wonder when it's all going to end, though, eh? No, it's definitely no. Because, I mean, I think, well, the reason that we're all stuck in is they're trying to just build up the necessary medical tools for when the shit really hits the fan. But I mean, this could go on for months. Christ. And even if the garden centres were open, that you could get some plants and everything. Aye. Aye. I know. I went into Marks and Spencer's yesterday to get my mum some messages and my brother some stuff because he's not been well. And I'm not joking. When I was there last week, there was security, and they were only allowing so many in. And yesterday they had loads of folk in, and I was the only one in there. I wore a bloody mask. I wasn't bothered. And folk were coming near me and everything. I'm going, for fuck's sake, you're meant to stay 2 metres away. I was getting really ratty. Here, Graham, go and tell Alan what the things are, because he's just woke up, he might understand better than me, right? Go down the new. Graham's he's got stuff in his garage that Scott might want.
What are they, Graham? Aye. Right. Aye. Right. Uh-huh. Uh-huh. Oh, aye. A time of light. Right. Right. Well, aye, well, now we would talk something. I need a grease gun. I'll tell you what, I really mean so. Have you got one of the guns you could put that you could put Sikaflex in? Okay, one of the guns that you could put. Aye. I'm just needing. No, it's a mastic gun. I need a mastic gun. That's what I need. You got a mastic gun? I'm needing one of them. I've not got one. Aye. When will I come out to get the stuff, or what will they?
No, you would hate to leave it on his doorstep.
Or leave it on your doorstep.
Or leave it on your doorstep.
Aye, just leave it on their doorstep, or leave it on your doorstep, whatever you want to do. Aye, right, okay. Right, no problem. Okay, cheers.
Would you take stuff?
I
was wondering that. I was hoping you would go.
I was waiting till he said it to me. You could eat it. Then that's an invitation there.
Aye.
She says, we'll leave it at her next afternoon.
On the doorstep. So when he came, what's going to happen? Him and Hazel's going out on the bikes the morning.
Oh, God.
He says she's been super glued to this seat the whole week. Just never budged. But that's what she's like. She just sits and knits all day, non-stop knits. I says, well, see when you're going out the bike, let us Kenny so we could come in here and laugh.
Subject to safety and regulatory approvals, as part of the Prime Minister's call to manufacturers to scale up production. Increasing this production has involved